Mr. Speaker, I move to suspend the rules and pass S. 2796, the Rural Opioid Abuse Prevention Act of 2022.
The clerk will report the title of the bill.
Senate 2796, an act to amend the Omnibus Crime Control and Safe Streets Act of 1968 to provide for the eligibility of rural community response pilot programs for funding under the Comprehensive Opioid Abuse Grant Program and for other purposes.
Pursuant to the rule, the gentlewoman from Texas, Mrs. Jackson Lee, and the gentleman from Ohio, Mr. Jordan, each will control 20 minutes. The chair recognizes the gentlewoman from Texas.
Thank you, Mr. Speaker. I yield myself such time as I may consume.
The gentlelady has the floor.
As I do that, I ask unanimous consent that all members may have 5 legislative days in which to revise and extend their remarks and insert erroneous material on S. 2796.
Without objection.
Let me also acknowledge that this legislation is from Senator John Ossoff, and I know how important these issues are to him. And at the very beginning, I want to thank him for his leadership. We have worked together as members of the Judiciary Committee, he in the Senate, myself in the House, and I want to applaud him and look forward to more work on this constructive approach to drug use. So S. 2796, the Rural Opioid Abuse Prevention Act of 2022, is bipartisan legislation that would establish a pilot program for rural communities within the Comprehensive Opioid Abuse Grant Program. The pilot program would make grants to rural areas to implement community response programs in order to reduce opioid overdose death. These community response programs would involve collaborations between public safety, public health, and behavioral health systems. The programs would seek to identify gaps in current treatment availability and establish treatment programs to reduce opioid overdoses in rural areas. Data from the Center for Disease Control and Prevention, National Center for Health Statistics, indicates that in 2021, there were an estimated 107,622 drug overdose deaths. The data also shows overdose deaths, including opioids, increased from an estimated 70,029 in 2020 to 80,816 in 2021. Mr. Speaker, what compounds this as I proceed in my debate here today is that just this morning I read an article that says in Texas, rural hospitals are closing by the dozens, impacted by the pandemic, and lack of personnel. We have a emerging, surging, if you will, synergism of default. Individuals who need care, can't get care, and hospitals in rural communities that are closing. With more than 200 Americans still dying of drug overdoses each day, it is even more important that we pass this critical legislation to get in the way, if you will. In my hometown of Houston, overdose deaths have been exacerbated by strained access to treatment caused by COVID-19 pandemic. Opioid overdose deaths have increased throughout the state of Texas, rising from 4,154 deaths in 2020 to 4,831 deaths in 2021. And when we wanted to get the antidote to opioid, unfortunately, we couldn't get state funding. Police officers, recovery entities, just couldn't get it because there was a philosophical disbelief that that had anything to do with some of the dangerous drugs out there to be able to help some of those who are in need. S. 2796 would enable local communities and community organizations to develop and expand initiatives targeting rural and low-resource communities. Eligible applicants of the grant program will be required to have a documented history of providing services in rural communities or regions highly impacted by substance use disorder. The programs supported by this legislation would be able to identify gaps in treatment access for rural communities, leverage federal resources to expand treatment options, and ensure rural and remote communities are not forgotten in our efforts to address the ongoing impact of opioid abuse disorder across the country. The point that should be made is that rural communities are north, south, east, and west. Building on a successful comprehensive opioid abuse grant program, this bipartisan bill would expand it to include a pilot program targeting rural communities. I want to thank Congressman Lamb and Senator Ossoff for introducing this important legislation. I urge all my colleagues to support the bill, and Mr. Speaker, I reserve the balance of my time.
The gentlewoman reserves. The chair recognizes the gentleman from Ohio.
Thank you, Mr. Speaker. I yield such time as I may consume.
gentleman has the floor.
Thank you, Mr. Speaker. This bipartisan legislation codifies into law an existing Department of Justice pilot program known as the Rural Responses to the Opioid Epidemic Initiative, established during the Trump administration. In 2020, the Trump administration created the new initiative to improve the opioid response and to reduce opioid overdose deaths in America's high-risk rural communities. The initiative enables 21 rural communities to receive existing Department of Justice funding to develop responses in opioid prevention, treatment, and recovery services. While this work is important, it is also critical that we do not lose sight of the dangerous drugs like fentanyl that are so easily trafficked across our southern border. The Biden border crisis is making America's drug crisis worse. We have seen record numbers of drug seizures like fentanyl, encounters of illegal aliens, and apprehensions of suspected terrorists at the southern border. For example, in fiscal year 2022, Customs and Border Protection seized over 14,000 pounds of fentanyl at the border and up to 10,000 pounds in fiscal year 2021 and 4,500 pounds in fiscal year 2020. And oh, by the way, these drugs are only what CBC officers catch. We do not know the amount of dangerous drugs that have slipped through the gaps due to President Biden's open border policies, but there is no mistake that drug cartels and illegal aliens are taking advantage of the crisis at our border. Meanwhile, our drug crisis continues to spiral out of control. We have seen the sad reality that overdose deaths in America reached an all-time high last year. An estimated 107,000 Americans died from drug overdoses in 2021, an increase of approximately 15% from the previous year. Overdose deaths involving both opioids and synthetic opioids like fentanyl sharply increased in 2021 compared to the year before. These dangerous drugs are killing Americans at record levels and destroying families and communities across America. Communities in rural America have been particularly hard hit by the opioid crisis. While passage of this legislation will continue the important work started by President Trump's administration to help rural communities combat this crisis, we must do more. We must also take actions to address the Biden border crisis and stem the flow of illicit drugs flowing into our country. Mr. Speaker, we reserve the balance of our time.
The gentleman reserves. The chair recognizes the gentlelady from Texas.
Mr. Speaker, I'm going to ask to address the House for such time as I may consume.
The gentlelady has the floor.
Let me, first of all, again acknowledge Mr. Lamb and Senator Ossoff, Congressman Lamb. This is an important piece of legislation, but my good friend knows that I'm going to have to add to this discussion by saying that, again, the question of fentanyl that no one wants to see proliferated and causing the disastrous conditions that we have. But listen to the story of Miss Alfaro, who was 19 years old, recent high school graduate, raising a toddler way up in Appleton, Wisconsin, getting ready to join the Army or considering joining the Army when she and a friend brought what they thought was an anti-anxiety drug, Xanax, in December 2020. The pills were fake and contained fentanyl, an opioid that can be 50 times more powerful. And so one of the things that we should understand is fentanyl is everywhere, and it's been determined that most of the fentanyl that comes across the border are brought over by U.S. citizens. And the other aspect that is very important, that doesn't specifically cover this bill, but at least this bill provides what the mother indicated. She didn't know anything about these drugs. She wished she could have helped her daughter. Yes, her daughter did lose her life. But the point that this legislation is making, let's provide information to these rural communities, but also let's understand some of the techniques that some states, local communities, were not providing law enforcement or anyone else. And certainly that is the fentanyl test strips and Narcan. And that certainly was a problem, continues to be a problem in the state of Texas. So we have to look at this holistically. And I think this legislation focuses certainly on getting families information, particularly in the rural areas. This was Appleton, Wisconsin. At least minimally there would have been information about this maybe in a broader way, because it says 2 years ago, I knew nothing about this, said the mother of the 19-year-old. We've got to do a better job. We've also got to get a better job of telling the facts about fentanyl that we all want to see to be extinguished from causing the loss of life. So I think this legislation for rural communities is a very good start, but we need to get and make sure that our facts are accurate as we talk about this deadly drug, which we want to get off the streets of this nation. And we need to find ways that can be very effective and need to keep working. With that, I reserve my time.
The gentlelady reserves. The gentleman from Ohio is recognized.
Thank you, Mr. Speaker. Would yield as much time as my good friend, the gentleman from Iowa, Mr. Feinster, as much time as he may consume.
Gentleman from Iowa is recognized.
Thank you, Congressman Jordan. Mr. Speaker, I rise today in support of this Rural Opioid Abuse Prevention Act. I am from rural America. I'm from rural Iowa, and I've seen the effects of opioids. And it affects all ages, from those that are in high school that get hurt, that have a knee go out or a shoulder, that get affected by taking opioids. So this bipartisan legislation, which I introduced with my colleague Connor Lamb, will help prevent opioid abuse and overdoses in rural America. In 2021 alone, nearly 100,000 Americans died from some drug overdose. This is unacceptable, and this bill can do something about it. My legislation will help the most vulnerable members in rural America, in rural communities, recover from addiction and provide our first responders with the support they need to save lives. There are too many barriers to rural health care right now, and we need to ensure that our federal programs can efficiently reach communities in rural America that can make a difference when it comes to opioid abuse. And that's exactly what this bill does. I urge my colleagues to support this important program because too many families have lost loved ones to the opioid epidemic, and they've also been affected by their addiction from a family member, and that needs to change. So I ask for my colleagues for support of this bill, and with that, I thank you, and I yield back.
The gentleman reserves. The Speaker recognizes the gentlelady from Texas.
Mr. Speaker, I'd like to offer some, I'd like to speak for such time as I may consume.
Gentlelady has the floor.
I'd like to offer a number of articles and to speak to the importance of this legislation. Thank the gentleman from Iowa for his comments and support. And I know that the gentleman from Ohio will likewise, I hopefully will join us. But it is important to speak the obvious. U.S. overdose deaths in 2021 increased half as much as in 2020, but are still up. So we know that we need legislation, specifically in communities in the rural areas, that would close or identify the gaps in prevention, treatment, and recovery services for individuals who interact with the criminal justice system in rural areas and create new efforts to address the opioid crisis. I ask unanimous consent to submit into the record article from Centers for Disease Control National Center for Health Statistics. That's unanimous consent. And then I think it is important to emphasize that really treatment works. And this is an example. Mr. Thomas Gooch has spent more than 30 years struggling with illegal drugs. The 52-year-old was in Nashville, Tennessee, somewhat rural, grew up in extreme poverty, was first incarcerated in 1988, and spent the next 15 years in and out of jail for using and selling narcotics until 2003. And that was the first time that he went into treatment and the last time he used drugs. This has to also be a component, which is the treatment of individuals whose conditions put them in this way. I ask unanimous consent to submit into the record. The opioid epidemic is surging among black people because of unequal access to treatment. I ask unanimous consent to submit this article into the record.
Without objection.
And then I want to indicate the article regarding the tragic young lady who died in Appleton, Wisconsin. Even now, give sympathy to that family and to make sure that we have the basic facts. Advocates warn that some of the alarms being surrounded by politicians and officials are wrong and potentially dangerous. Among those ideas, that tightening control of the U.S.-Mexico border would stop the flow of drugs, though experts say the key to reining in the crisis is reducing drug demand. And that's looking for Xanax, and someone made a phony Xanax, and then fentanyl was in it. That's just heartbreaking. It's tragic. So we've got to know where to spend our resources. I ask unanimous consent to place this article in the record about myths about fentanyl persist as opioid continues to cause overdose deaths. I reserve my time.
The gentlewoman without objection, and the gentlelady reserves. The gentleman from Ohio.
Thank you, Mr. Speaker. I just want to thank Mr. Feenstra and his work on the legislation. We support the legislation, and we yield back.
Gentleman yields back. The gentlelady from Texas, recognized.
Let me thank the gentleman from Ohio and indicate that we are pleased to likewise support and thank Congressman Lamb, the gentleman from Iowa, Senator Ossoff, for introducing this legislation. And we too urge all of our colleagues to support the bill and as well to ensure that we provide the kind of really deep collaboration in our rural communities to really help people who don't have access either to this kind of treatment, knowledge, prevention, and then, as I indicated, to medical care, because hospitals are closing. And so this is an important legislative initiative, and I'm hoping that we will support the Rural Opioid Abuse Prevention Act because it's bipartisan legislation. Time for our nation to face the increased overall overdoses and deaths in everyday community, large and small. And finally, with more than 200 Americans dying of drug overdoses each day, Congress must act to support small and rural communities in addressing this crisis. I urge my colleagues to support the bill, and I yield back the balance of my time.
The gentlelady yields back. The question is, will the House suspend the rules and pass Senate 2796? Those in favor, please say aye. Those opposed, no. In the opinion of the chair, 2/3 being in the affirmative. For what purpose is the gentlewoman